Well, there is. And if you do just a cursory look at saturated fat and insulin resistance, there's a whole host of scientific articles saying that saturated fat increases insulin resistance and on and on and on. And that is something that, I think part of that we're looking at, there's one high saturated fat diet, decreases insulin sensitivity without, changing intrahepatic fat or something like that. So we have those. Why are those studies there? When you see those studies that show that, what are your thoughts?
Well, one of the thoughts is that they probably were not a low carbohydrate diet. They might have been high fat, but not low. You have to get the insulin down. Just seeing it work out so well, just so many parameters get better, and people, everything seems to get better when you get the insulin down, and that's whole insulin issue is creeping into. Not creeping into, it's in all the specialties to some degree, whether it's neurology, psychiatry, all around. So really that whole worry about the fat, go back and look around, look at what people observed before this whole diet issue from the Kellogg's on. Before that, everybody recognized that sugar and starch were a problem. It was common knowledge, and people that fed pigs knew how to make a fat pig, and you wouldn't do that to a human.
Yeah,
I'm not very. I guess when I think about this, I know what I'm thinking, but to articulate it, it's like it's so obvious.
Yeah, I just pulled up the study, and I was just kind of looking at it, and the carbohydrate content of that particular was 47% of the diet.
There you go. Yeah,
it's still, like I said, some people talk about this thing called the Randall effect, where carbs and fat simultaneously cause problems. Somebody's asking about Syndrome X. Gerald Reven, who's the one who actually discovered or coined the term metabolic syndrome or Syndrome X. This is from 1980s or something like that. When was it Reven?
Yeah,
70s, 80s, I think, something like that. Yeah.
Maybe 78, yeah.
Yeah, something like that. So anyway, that's a guy who was the initial investigator, maybe one of the first ones that really coined this term.
Yeah. He was from Gary, Indiana.
Oh, he's from Gary, Indiana. Okay, interesting. I grew up not far from Gary, Indiana. I went there. I remember doing a track meet in Gary, Indiana when I was a kid. But Michael Jackson's also from Gary, Indiana, for those who don't know.
Right.
Let me ask you about, when we look at metabolic syndrome, it's interesting to me that LDL cholesterol is not part of that diagnostic. If you look at it, the classic definitions for metabolic syndrome don't talk about total cholesterol, LDL cholesterol. Why is that, you wonder?
Because it's so random all over the place when it comes to people and their risk actually going. When folks have a heart attack, you can't tell what it's not. I don't know why they talk about it exactly, because the thing that happens to me is I see one of my patients has been to the ER and flown off to Missoula for a cath. And then I think, oh no, they're not on a statin. And then I run the numbers and it's like, oh, they didn't qualify for a statin because they didn't have the high LDL. So in a sense, in my experience, haven't even seen it. But if you look at those calculators, they're really surrogate calculators for hyperinsulinemia, because they're asking about diabetes and hypertension and HDL cholesterol. And it's like, so you're looking at all these things that lower the insulin, and all your risk factors on the American Heart Calculator go away. So it's kind of funny that people don't put that slight bit of root cause into effect, and say, oh, I could fix this all with diet. And Gerald Reven knew about it.
There is, it seems like in the last few years, there's been an explosion of medications. I'm particularly looking at things like autoimmune conditions, ulcerative colitis, psoriasis, rheumatoid arthritis. These drugs are ungodly expensive. These are you're looking at $10,000 for a single injection on some of these medications. I looked at Stelara, the over-the-counter cost, without insurance. Somebody's paying, by the way, even though it's insurance, we end up paying it through taxes or whatever the insurance premium is. It's ridiculously expensive. And it just seems like it's just, people aren't even batting an eye at this stuff. It's just like, oh, well, it's just a continued thing. Are you seeing a role for diet in other things besides straight up metabolic syndrome?
Definitely. One of my patients with rheumatoid arthritis could actually plan on being pain-free by just fasting. And he knew that was a very short-term fix, but he said, I cannot hurt tomorrow if I don't eat today, which is an interesting individual's observation. And he did have metabolic syndrome. But the autoimmune things, it's real in that I've had people do carnivore and succeed.
Yeah.
And then you get into the whole gut thing. One of my favorite people, just the way she, her bluntness, which is fun, is Dr. Natasha Campbell McBride. You know, I love the way she says, heal and seal the gut. And it starts out with meat broth. You know, I mean, you got to just give the gut the thing that it's the easiest on the gut is meat. And then let the gut heal, because you know that there's also, it's so plausible that bad things, how technical is that, are getting from your gut and your blood that shouldn't be there.
Yeah.
Because I know my patients have leaky gut.
There was a recent study that came out a few weeks ago looking at rheumatoid arthritis and high fiber diets, and they found out that the high fiber diets interact with the microbiome to basically increase the rheumatoid arthritis symptoms. So we're seeing some of that being pushed in the literature now. If you know how to look for it. So,
you know, I was going to say, here's a formula for getting a positive research study. Choose a chronic disease, give them a carnivore diet, get a positive result. Next. I'm not a researcher.
Well, we actually, in fact, I'm going to Nashville tomorrow to help arrange that study. It's going to be done looking at several autoimmune conditions in carnivore diet. So somebody gave some funding to that, and we've got some ranchers that are willing to help supply some of the meat for the study. And so it's going to be kind of cool to get that done. So pretty excited to be part of that. Let me ask you about Montana a little bit. And I've been to Montana a few times over the years, but I haven't spent a lot of time there. You think about it, a lot of ranchers, a lot of people are outside, they're active. You wouldn't think obesity would be a big problem. What do you see out there? Is it a pretty significant issue in Montana, or is it better than some other places?
I think it's very significant here. It's changed so much. And I think some of that's epigenetics, that kids are born to overweight mothers and they have a harder time yet. So and the people that I kind of really push on hard are the ranchers that have metabolic syndrome. And I tell them, if you had help that treated your horses the way you treat yourself, you'd fire them in a heartbeat. Because I wish ranchers looked buff. And I'm not going to be shy to on that one. You know, it's like, how come you got a potato gut? How crude could I get? Maybe somebody's going to. But I've already told my patients that. So,
well, I remember when we met, I think in Denver, and we talked about that. You were talking about the ranchers need to be a better example because they're out there, and they're most likely eating meat, but what else are they eating? They're eating all the sweet tea and potatoes and all the pies and garbage that go with it, perhaps. Yeah.
And I want to say a quick thing. If I don't want to sound crude about talking about somebody's anatomy, but when you have a formula for how to fix a problem, I find it more chit-chatty about the problem. My patients come back, I mean, I'm really very sensitive. And I also deal with a lot of people that are morbidly obese where I'm very sensitive. And they also realize here's somebody that's not scared of them and doesn't tell them to eat less. That's torture.